All right. I want to welcome everyone. Thank you so much for joining us today. We have a really, really exciting webinar for you, and I am very honored to introduce my co-presenters. So let me introduce myself. My name is Adrienne Asta. I'm a licensed massage therapist for over 21 years, and I'm proud to be serving you and the industry as president of the Massage Therapy Foundation. And I would like to introduce Dr. Portia Resnick and Dr. Susan Salvo. Dr. Resnick is a board-certified massage therapist and athletic trainer who has over 25 years of experience in the sports medicine field. She completed her PhD in education with a concentration in kinesiology at the University of Hawaii at Manoa, where her research explored the use of heart rate variability as a clinical measure of recovery in NCAA Division I athletes. Currently, she is an assistant professor and the coordinator of clinical education for athletic training program at the California State University, Long Beach. She has been a volunteer with the foundation since 2015 and is the 2014 Gold Award winner for the Massage Therapy Foundation's Practitioner Case Report Contest. In addition, she has served on the board of directors for BCTMB, including 2 years as president of the board, and is author of Sports Massage, Injury and Recovery Module for the AMTA BCTMB Sports Massage Specialty Certification Program, is currently serving as a trustee for the Massage Therapy Foundation. Dr. Susan Salvo has been practicing massage for over 4 decades and has a doctorate in education, a master's in instructional design, technology, and a bachelor's in education. You might know Susan for her work. She's written 2 best-selling textbooks, Massage Therapy, Principles and Practice, and Mosby's Guide to Pathology for Massage Therapists. Susan is prolific and has contributed to works in other publications, including Teaching Massage, Modalities for Massage and Body Work, Muscle and Bone Palpation Manuals, and Massage and Manual Therapies. Susan also teaches regularly at the Louisiana Institute for Massage Therapy, and she travels across the country conducting workshops for practitioners. She also posts videos to YouTube on instructional design and delivery, and her mission is to advance the massage profession through education and research. So ladies, thank you very much for doing this webinar with me today. I'm really excited to talk through it. Next slide, please. A little bit about the Massage Therapy Foundation. We're a 501c3 nonprofit organization that was founded 32 years ago, and our mission is to advance the knowledge and practice of massage therapy by supporting scientific research, education, and community service. Some of the programs and the opportunities that the foundation provides revolve around research grants, research conferences, and a scientific journal that's free to you, educational webinars, podcasts, and other materials, as well as community service grants to serve those who otherwise wouldn't have access. Please visit the Massage Therapy Foundation website at massagetherapyfoundation.org for all of the resources that are available to you and your colleagues. Next slide, please. So I am going to turn this over to Portia, who is chairing our ergonomics work group, to talk about the phase 1 white paper, which is what the subject is for today's webinar.
Yes, well, thank you, Adrienne, and I'm super glad to be representing the foundation in this endeavor. So our phase 1 of the Ergonomics project was a collaboration between the Massage Therapy Foundation and Briotics Health, as will our phase 2. And so phase 1 kind of really set us up for the future of looking at this ergonomics project. And what we used phase 1 for was to develop a white paper. That white paper is available on our website, and we'll also have some links to it coming up a little bit later on. So looking at what were the goals of this particular project. And so we had 2 goals of this project. The first thing is to create a formal job task analysis. So we were looking at the job of being a massage therapist. What do we do when we are at work all day long? So we were looking at the individual tasks. And the purpose of this job task analysis was to help educators, employers, as well as practitioners to understand exactly what we're doing and what our body is going through within the different tasks of our day. And once we examine the tasks of the day, we can then use that to create an optimal work environment, whether it's table height or room size. And then really always our goal is to support massage therapists so that they can have a good long career of putting their hands on a lot of people. So that's what we were looking at with this project. So what is ergonomics? And there's a great definition section in the white paper, but to break it down, it's both an art and a science. And I love that concept because anytime we talk about massage, we always talk about that crossover between art and science. So art and science coming together in how we design things such as our workflow processes. How do we move through that actual massage? How do we create that environment for the massage, not just the typical things we think of like the lighting and the music, but also how do we arrange that room where we're actually working so we can have a good system and a good flow in order to get through everything we're doing. So we're not only safe, but optimally fit. We're cutting down on injuries, we're cutting down on fatigue. Fatigue leads to injuries. So this is really what we want to be able to look at through this job task analysis. So how did we go about doing this? Well, like any good project, we start by asking a lot of questions, not just of ourselves, but of a lot of people. So we started with this preliminary survey with help from Briotics to send this out to a lot of therapists, to students, to gather information to kind of find out, okay, what's going on here? What are the demographics? We always want to know our population, so age and gender. We want to know how many years they've been practicing, maybe what environment they practice in, all the background information, the types of treatments that are performed. And this is always an interesting one, and we'll get back to pressure level a few times within this webinar. How do we kind of grade our pressure? What type of treatment do we use? Where are we going with this particular treatment that we're giving to our clients, our patients? But then also, what level of discomfort are we feeling as the therapist? Many times we talk about this in these webinars, in CE classes, where we're talking about only about our client. Keep in mind, this study was really focusing more on the person performing the massage, not on the person who's on the table. So thinking about that, do we have any musculoskeletal discomfort? How are we feeling? What is our fatigue level? And we were able to use all of this background information to then create this follow-up study. And so again, this is our phase one, our first follow-up from that information. What we did was we took what we learned and we created a data collection on site. And what I love about this type of a data collection, it's what we consider to be quasi-experimental, because the therapists were not given direction of work on this area for 5 minutes or do this technique this number of times. They really were able to go about this treatment at their own discretion. So they could do their own massage. And I love massage and I love research, but the problem with massage research is they clash because research is many times very, very rigid. And this was not done in that way because this is a job task analysis. So it's a totally separate idea. So there were 30-minute sessions, and during those 30-minute sessions, we worked on a variety of areas. We worked on the neck at 2 separate times in prone and supine, as well as a combination of neck and back prone, the back itself, thigh and leg prone, thigh and leg supine. Notice arms, feet, hands were not necessarily in this. Again, this was just to kind of create a snapshot as far as what was going on. We performed this in 2 locations, one on each side of the country, and we were able to look at what the therapists were doing. Okay. So this observation was done via video recording of the sessions. Again, consent on both with client and therapist. And again, the clients The people on the table were not there to receive a massage. They were there to be part of this project. So it was a little bit different from that perspective. And because the sessions were video recorded and the ergonomists, I'm going to trip over that word quite a few times today, but the ergonomists were the people that were actually breaking down what was going on with that person. So they were the ones who were reviewing this. It was not massage therapists looking and analyzing somebody's technique. We were looking at the skeleton, the body, how everyone was set up. They recorded the table heights, not for the purpose of knowing what someone's table height was, but once we put them onto the video, we wanted to be able to match that. And you'll see some of our pictures later on that'll have lines drawn on it. And that's part of the work being done by the ergonomists. They did a really cool force matching pressure, where what they did was would stop in the middle of the session. Again, remember, we're not focused on the body on the table, we're focused on the therapist. And they would stop the therapist and say, okay, match the force that you just put into this person's tissue with this particular device. So we could try to calculate, because there's no good way to actually calculate the force within the tissues. We kind of have to do that a little bit separate. So they were able to do that, and again, try to match that particular force. And again, this was done with people working in some different locations. The actual videos were done in some different locations, because we all know, depending on where we work, that's going to affect things such as our room size and our room setup. So what did we find out? Massage therapists spend 75% of their time on massage treatments. To me, that's one of the best things to hear. Like, yes, we're spending most of our time putting our hands on people. So that's really where the focus of what we're talking about today is. But the other 25% of that time is divided up into documentation, billing, consultation, assessment, and then some other administrative tasks. And again, if you want some more details on this job task analysis of the whole thing, please go ahead and view our report. But for today, we really want to focus on that 75%. That 75% is our is what we really want to look at. That's kind of our goal. So a few things to keep in mind. We took these half-hour sessions and we kind of aggregated it based on the background information of what would be kind of a standard work week for a massage therapist. So we tried to standardize this among exposures. So assuming 30 clients per week and 60-minute sessions per client. Now, this is not the same. Adrienne, I know you're in practice. How long are your sessions typically?
A typical session for me is 90 minutes, but there's a fair amount of I say that, and yesterday I did 5 60-minute treatments. So, in preparation for this, of course, 60 minutes is typical, but in my particular practice, with the kind of massage that I do, for how long I've been doing it, I see clients for 90 minutes typically.
Mm-hmm. And Susan, how about you?
90% of my work is 60-minute massages. Absolutely.
Right.
So and I'm not a good representation.
Yeah, and I'm not doing as much private practice, but I was with Adrienne, and most of mine were 90 minutes. I had a client I would work on sometimes for 2 hours. So again, we're thinking about these different exposures. So for those of you listening, kind of take this information, understanding that. Also that 30 clients per week, again, that's kind of an average. We have some really good weeks where maybe it's a little bit more, maybe it's a little bit less, depending on what's going on. So really thinking about this. Now, as I said earlier, when we did this and we broke everything down and looked at it, we did not time the tasks. So we just told the therapists to do this treatment. You have 30 minutes, kind of divide that up as you wish. So what they found was the 3 longest duration tasks were neck supine, neck prone, and then neck and back prone, which included neck and then the entire upper, mid, low back, So cervical, thoracic, lumbar regions, all kind of included. So I don't know what your thought is on those particular areas. Would you say those are your long duration tasks as well?
So for me in particular, here's where we see some language kind of translation from ergonomist to massage therapist. Here's where we start to question it, and this is what's great about doing a project like this and having a white paper is it starts the conversation, right? So to me, neck prone, like I do one technique, I petrissage so that we're lifting the tissue because you don't want to press on the neck, right? You don't want to press downward like that. So I'm curious to see when the ergonomist plugged that task, the duration of that task into that category versus neck and back prone, where there's, kind of one effleurage that goes down the whole back and then up to the base of the skull. So, and it depends on the client, right? And we're looking at they looked at a 30-minute session. So our choices when we curtail a session might look different. I might still keep my introductory, effleurages and myofascial glides in there at the same number of strokes that might, be necessary on average, but I might cut other pieces. Whereas with a 60-minute massage, I might still do, I'm throwing a random number out there. This is, I might still do 3 effleurages, but I have all of this other time that I wouldn't I wouldn't do double the amount of introductory strokes in a 60-minute massage, right? So these are all things that we hope that you're starting to think about as we go through this information. The neck prone as a long task seems off to me, but again, do they mean cervical? Do they mean, the mid and upper trap, and levator, attachment? So a lot of it is, let's look a little bit deeper into the information.
Susan, anything to add to that?
Well, I'm just going to kind of echo what Adrienne said. So I'm actually a supine neck fanatic, both as a giver and a receiver. I actually start neck supine, I end neck supine. So I do spend a lot of time on the neck. Also, I agree with Adrienne on the neck prone. I suspect, because there is a safety concern, with working on the neck prone. Is it really neck prone? So are they really working the upper traps and the suboccipitals? I suspect yes. But again, that might be fun to have another massage therapist look at those videos and see what they come up with. So, but I do agree that the longest tasks are spent at least in these areas. Inferior, superior, but I definitely agree.
Yeah, unless I'm working on a runner who's getting ready for a race, I'm going to kind of agree with that. Then I may spend more time on the legs, or even post race, distance race. I may spend more time on the glutes and the legs. But yeah, otherwise, and most people who come into a massage room, that neck and back, those are the areas where they really want you to concentrate on. So absolutely, I would agree with those as long as tasks. And we were kind of, as we were prepping for this webinar, kind of discussing that whole, well, what is neck prone? And I kind of said, well, I feel like it's the spine of the scapula and up. That's kind of where my dividing line kind of was, right in there. And somebody else may disagree with that, but that's the fun part. That's the fun part about these discussions. Right? So let's talk about the ergonomic risk exposures. So now we're getting into a little bit of numbers, and a little bit of, again, what the ergonomists, told you I was going to trip over that, what the ergonomists are looking at. So now these are the risk exposures based on the data collection only based on what they saw. And again, we can't really extrapolate these to every single person, but they basically found, again, those higher risks with those areas. So the average number of times when the person was working in those areas and their ergonomics were at risk for causing things like fatigue, whether that's cardiovascular fatigue, whether that's musculoskeletal fatigue. Those three were the ones that showed the greatest risk. And we notice it's that neck plus back more so than the back itself that was at greater risk.
I have a question. Can we go back just for a quick second?
Sure.
And again, I have the white paper right next to me, but I don't want to read it because I have the author right here. What does interval mean?
So the interval, I think, was kind of that time that we went from task to task as interval. So as we're moving, and one of the things, and I remember when I was a massage student learning this, going, you never take your hands off, like you always make sure the patient, the client knows where your hands are. So that interval is kind of that change of position where we're kind of making sure that we're still in contact with that person, which I always agree is especially important if they're in that prone position and they can't see you, that they want to be able to know where you are.
It's interesting that it's close, right? It's close to neck prone, neck supine.
Yeah.
It's something to talk about.
Yeah.
And I guess other was like, I don't know what's going on.
It would be something that didn't fit within. So for example, because arms were not included in, but let's say somebody forgot that, or they had the time, or they like to work on arms and hands, and so they did a little bit of that. Yeah, so that's kind of what the other would fall into as a category.
Okay.
So, and here's where we get into that great question about the interval. Most people did not change position when going neck, shoulders, and low back. And this is what created some of these greater risks. So like I said, with that interval portion, if we're transitioning from place to place, we may not be using the best mechanics to get there. And I saw this as really interesting because I'm thinking, wow, was it that shorter 30-minute session that led people to maybe not want to change positions quite as often? Is it their own style as a therapist? But one of the things to note is that it especially increased postural risk, which again puts us in poor body mechanics, poor position. Poor position leads to that increase in fatigue, most especially in the trunk region. So they were most likely leaning or twisting in a position that was not advantageous for that therapist.
We have a comment in the chat from Margot, who said it would seem to me ergonomics would vary considerably with sitting for neck work and a hydraulic table. And yes, we're going to talk about that a little bit later.
Absolutely.
All right, and then this next set of numbers that we're going to look at is from the REBA, which is the Rapid Entire Body Assessment. So this is an ergonomics tool that our ergonomists were using. And then they looked at high versus low scores. And what we're noticing here is not just the high scores or just the low scores, but it's that variability. And because it's high variability, that's what makes it difficult to maintain low risk postures. If you look at leg prone, the high and the low are exactly the same. So we're able to keep the same posture throughout, okay? It's that variability between these two scores. We cannot maintain those low risk postures. And that's really what is causing some of the issues within working on these areas. So what does this mean for us? Okay, this is really the meat and potatoes.
The purpose of this webinar.
Yes, absolutely. The purpose of this webinar, from white paper to practice, how do we take all of this background information and how do we put it into practice? So we're going to start right in a good place with our comment from the chat about neck supine. And the advice that was given from the ergonomists: work in a seated position for the neck. And I found this interesting because anytime I work neck in supine position, I'm always either seated or kneeling. How about you ladies?
Absolutely.
Yes, for sure.
Like, I like to tell people that my stool is my absolutely favorite accessory. And I really am kind of a nerd about it. I get like the chrome stem with the legs. Yeah, I mean, I'm all about the stool.
Oh, and if I have that rolly stool, because I'm really able to keep that upright posture. And instead of leaning or turning, I can kind of just slide a little bit with that. So absolutely. And here's the key to it. It reduces those eccentric demands. Okay, so we're going back to our anatomy, right? Those eccentric demands are erector muscles or postural muscles. They are meant to keep us upright. When we're in a flexed position, they're eccentrically contracted. They're not meant to sustain long periods of time being in that position. Okay? It's a strain on them, and that can lead to, again, that musculoskeletal fatigue. Sometimes that fatigue leads to poor body mechanics. So that compound, those 5 60-minute massages may have felt okay, Adrienne, but maybe if we added a 6th in there or a 7th during that day, maybe our fatigue would have been a little bit greater. Also lessening that neck extensor movement as well, keeping that head upright. And I also think that the second part, the keeping the hands visible, really works with that. I feel like when our hands go away, our body starts to follow. So I've always learned as well too, to keep my hand, if I can see my hands, then I know where I'm working.
Yeah, when I have to check myself the most is definitely the neck posture, because I'm just so fascinated by the work. So I'm really, when I catch myself with poor mechanics, it's usually because I'm looking at the work. Part of it is assessment, part of it is like, oh, what's happening to the tissue as I do this? There's a local twitch response that's giving me some information, examining the skin, and then just realizing that as I'm going through, that assessment or fascination, whatever it might be, that I'm like, whoa, and you can feel it the next day. And the hope is that this information will give you just a reminder to check in with yourself sooner, before that strain really, really catches you.
Yeah, two things I'd like to mention. There was a study I cite, 2006 study, where massage therapists were saying the #1 area of discomfort, musculoskeletal discomfort in their own bodies was, typically, fingers, wrist, and hand. But a 2022 study came out. Of course, I'm sure there's many more massage therapists that are practicing now. And the neck was #1 as the area that we were complaining about that's hurting us the most. But two things, going back to what Adrienne said, at our school, we actually make the students do a blindfold massage to completely stop them from using their visual input. And again, that helps them be more also mindful of their body mechanics, but not rely so much on sight. Really kind of fun.
I've done that also. Yeah, I think that's a ton of fun to be able to do. And a lot of us, sometimes I close my eyes because I want to feel the tissue through my fingers, as opposed to really seeing our eyes do lie to us sometimes, that confirmation bias.
Yes, and for, if anyone is on the webinar that is in a school environment, or if you're students, give this a shot. I think this exercise portion, I had the privilege of teaching and going to school together as well. And this was part of the curriculum we went through, and it took my massage from good to great very quickly with that exercise, not only from a body mechanics standpoint, from a draping standpoint, and a palpation standpoint, and a pace standpoint, a communication standpoint. We highly recommend doing this.
Yes, absolutely. Now talking about the neck in the prone position, okay? So as well, we're talking about keeping that vertical alignment. And I love this, keeping the trunk aligned with the force application. So we're not saying you have to kind of stand still with this, but make sure that if you're moving with that force, that force is moving forward, your body is moving forward with it in that aligned position. So not bent over and leaning forward, but actually shifting that entire trunk forward. If you can, position yourself next to, not above their head. So again, moving our feet to kind of access. So maybe getting to that cervical region from the side of the table, or using a seated position for lighter force applications. Okay. And then talking about the neck prone plus back, and this one brings in some interesting debate between us. Avoiding strokes that span the entire length of the spine and separating into two areas. So Adrienne, I'll let you take that talking point.
Thank you. Yeah, I feel pretty passionate about this one. So the purpose of the Massage Therapy Foundation self-funding this project is to make sure that we can give massage therapists the tools in order for us to create career longevity. So while this is specific to ergonomics, we also have to keep in mind that career longevity is the actual goal. And I feel like a back effleurage that goes from cervical spine to iliac crest and back up to the to the superior nuchal line, that is probably, if we did one technique in the massage, that would be the one that I would request. And I don't know if somebody avoided a full back, massage, I don't think I would rehire them. Right. So when we're talking about, this recommendation is coming from an ergonomist, right, who doesn't work in our profession. So we want you to be aware of, kind of that from that last slide, or it might have been 2 slides ago, where we want the pressure, we want our mechanics to stay in line, our back to stay in line with our hands and not increase that distance. That's probably a better visual for me, because I'm not going to go back to the person who is breaking up that back effleurage, and therefore they're not making money, and therefore they're just switching careers because they can't be sustainable. So again, when we're reading the white paper, keep in mind that these are just some things from an ergonomic standpoint to be aware of, but we may have other options when we are when we're looking to modify.
Absolutely. I mean, I agree with you. We need that full back effleurage, but maybe that's not, 5 minutes of back effleurage. Maybe it's a couple of strokes here and there as needed. Maybe that helps us again to kind of move positions, that kind of in between area.
Yeah, and not getting stuck behind the face rest, right? Making your lunge or your split stance or whatever archer stance, whatever 3 other things we're calling a lunge position. So you're just to the side of the face cradle, gives yourself kind of, that much more distance of lunge to be able to hold that angle between your arm and your back, right? So these are all fine options.
Yeah, I don't think one interesting observation about this particular picture, remember, I haven't seen this picture before yet, but I would really question the use of a holster for this, because if a therapist does have a holster and it's positioned in front of their body, they might even unconsciously create like an arched back to keep that from hitting the client or keep that getting in the way. So just to be mindful of anything that's in front of you that's potentially preventing good, efficient body mechanics, I think you need to be mindful of. But another thing we talked about in our prep session for this webinar was these principles, everything on this slide, we teach in massage school, it's in the textbooks. But it's so interesting when students get to that student clinic, all of a sudden, some of this information just leaves. And then they start to get uncomfortable, they start to get fatigued, they come back to class, they wonder what's going on, they ask you to observe their body mechanics and tell you what's wrong with them. You point out the things that, like these things right here, and they go, oh yeah, I forgot. So, and that's another thing we have to remember is, this education is wonderful, but it's how to keep people remembering when they're in that treatment room, either a Post-it note or maybe a little poster. I think the Massage Therapy Foundation has a poster. Put that in your treatment room as a constant reminder to practice these wonderful tips that you're giving us.
All right, now looking at just the back, so not back plus neck, but just back. Remain upright, not climbing onto the table. And even though I do sports massage, I do try to avoid getting on the table with that person. There's not a lot of space for that. I know that there are some techniques where getting on the table is appropriate. So understanding that, but I love this concept of positioning yourself as close to the table as possible, which brings back to Susan, what you said about having the holster, if that's getting in the way, if that's keeping you from getting close. And then monitor pulling techniques, things that force you to cross the midline. I do think something that's not on here, because again, this was just looking at back in that prone position, maybe a sideline position is more appropriate to work on the back based on particular techniques that you're trying to do. Again, keeping in mind that the person's now going to be higher if they're in a sideline position. So we may need to drop the table. So working through the position of the client, maybe positioning them closer to you. What other tips do you have for working on the back to keep good positioning?
Adrienne?
So I feel like, keeping those, kind of, again, that concept of, not reaching and moving your body, so that it's maintaining. So we think of part of being watched with body mechanics is that we tend to stiffen. Right. And we are not designed to be stiff while we're doing anything, really. It's being stiff in movement or the exact opposite. But our bodies are designed to move. So we want to just do that as efficiently as possible. So, yes, positioning yourself as close to the table as possible. But if I'm working ipsilaterally, I might want to step back a little bit. Right. So I think just awareness of the distance, that that eccentric strain that might be happening. I think those are fine points to to keep in mind as we're working on the back. It's also going to depend on the size of my client, right? So I can have a really kind of barrel-chested client that I can't work cross table, but if I have a very slight client on the table, I feel like I can ask them to come closer to me and still be okay. It depends on the size of my body versus the size of the client's body. And it's something I believe we're going to talk about it a little bit later. But it's something when they were talking about measuring table height. Yeah, that's a good place to start, but there's so many variables to that depending on the technique you're doing, the size of the client that you're working on, the goal of the massage, which would, make you choose, one particular set of techniques over another. So this is, there's a lot of variables that we can make sure, and depending on where you work and the tools that you have really can help shape the decisions that you make about your body mechanics.
Yeah, and let's keep in mind, I was going to say, let's keep in mind that the table height was for them to use to create some of these images with these lines, right? It wasn't to come up with, this is the appropriate table height. So I just want to make sure people keep that in mind. And then Susan.
I like to remind students and practitioners to lean up against the table. In fact, sometimes I will, one of my teachers, Pat Kresge, said that she can always tell a good massage therapist with a good body mechanics because they have these wear lines on their, going back and forth on their thigh parts of their pants. And sometimes I tell therapists when I'm practicing, I'll close my eyes and I'll listen, and I hear that of the pants legs against the sheet of the table. And we do this experiment where I said, okay, guys, I want you to think about the massage table being like an external skeletal system. So they'll stand by the table, like maybe an inch, and I'll say, close your eyes and just notice the strain in your body or lack of strain. And then they just lean against that table. It can just be the very slightest force. And maybe it's proprioception. I'm not quite sure how that kicks in, but all of a sudden there's less strain in your body. So I'll remind them to take advantage of the massage table, and also to keep the arm as close to the trunk as possible. And anyway, just all those little tricks. And of course, we talked about this before, letting your hands and your feet mirror each other. So if your hands go up, your feet's got to go up. So there's all kinds of little tips that you can use to kind of put these things into practice. But sometimes I just think so much of CE classes is just reminders. I know you probably learned this in massage school, but here's a good reminder of all these wonderful foundational principles of body mechanics. But a lot of this is just reinforcement. This is great stuff.
All right, now looking at the leg, both in the supine and prone position, again, talking about shortening the strokes to avoid overreaching. And again, I'm going to agree that like that full leg effleurage, it feels so good. So being able to work that whole distance, but position yourself in such a way that you can reach that. And that includes, like it talks about moving your feet in the direction of the stroke. So moving your feet and hands. This is staggered stance, and I know Adrienne, you brought up some of the different names for it: a staggered stance, a lunge stance, one foot in front of the other, a good balance stance. Any other particular names for this that anyone can think of to describe this?
Bow stance, archer stance, asymmetric stance. It's got a lot of synonyms.
One of the things to consider with that stance is that you want to make sure you're not walking on a tight, like a tightrope, right? You don't want your feet lined up. You still want it to be hip width apart, right? So the whole point is a solid foundation, and kind of narrowing that point, kind of puts the onus on the upper body to control. So you want to keep strength and control in the lower half.
Yeah. And we're talking about being able to have good dorsiflexion and plantar flexion, even down to the ankle. I mean, we're talking a lot about the back position, but if you don't have good mobility in your ankle, if it's something that, injury wise has caused it, that's a whole nother story. But talking about kind of that normal person, that those normal ranges of motion, having that good ability to dorsiflex, to flex at the knee, at the hip. So really using all of our joints to kind of keep us in line. Moving the client more caudally to access the feet. So if we are working with them in a prone position, maybe take them out of that face cradle if we need to. If they're supine, and how many times do we turn a client supine and they're still with their head, right at the top of the table? Having them slide down. That goes back to Adrienne's point of how tall or short is the person on your table, and how well can you access the feet a little bit. Anything else with this particular area to talk about?
I like to move the lower extremity in kind of a V position to get those lower extremities closer to the edge of the table. So it help with body mechanics. So that might be another little tip there.
I think, yeah, and I think in the white paper it said that the neck back effleurage was the longest glide, and I'm personally disagreeing with that. I think prone leg is going from calcaneus up to iliac crest is the longest, and if we're able to start our lunge from from the most far back lunge position we can to the most far forward, we can really maintain a nice, easy, efficient upper body.
And again, only doing one or two of those strokes and really concentrating our area on a smaller aspect, whether we're talking about the shank, the low leg, or we're talking about the thigh. All right, and this is always a big one. This is such a big thing for me when we start talking about protecting the thumb. So our IP joint, our interphalangeal joint, okay, our MCP joint, our metacarpal phalangeal joint, okay, and then our carpometacarpal joint, the one saddle joint that we have in our body. I love when I get to teach anatomy at any given time. But these are the joints that are really going to take up a lot of force. And while I don't teach massage therapists anymore, I do teach manual therapy to athletic trainers in my current position, and I'm always telling them that there is not any one person who is worth wrecking your thumbs for. So I'm always reminding them to be careful of their thumbs. So consider things like two thumbs together. So bracing your thumbs, okay? Resting your thumb on your index finger in order to support the joints, using a knuckle or another tool that is not your hands in order to dig into some different areas, but really thinking about high force compression, using your thumbs, I always say sparingly, only when necessary to do a particular technique. And then it's nice to kind of stop and break that up with an effleurage. It feels nice to the person on the table, but it's also nice to open up your hands a little bit. So really thinking about it. What are some of your tricks for protecting your thumbs?
Not using my hands. We didn't see much, if any, forearm use. I don't know if it wasn't used or it was in that other category, because they didn't know where to put it. I use it a lot. I use it quite a bit. And I've learned to use it for more than just this one myofascial glide, right? Just really utilizing the proximal ulna to, and not the olecranon to really just have a nice kind of sharper but broad glide. Really gets the job done. So not using my hands. I think that's a big piece.
And I'm just going to clarify, because I know that there was a question in the chat with this. We're not saying that people aren't using other techniques. Keep in mind, this white paper is showing us what are the things to avoid, right? So, and this presentation especially, we're talking about what to avoid. We're talking about good practices. So if you were part of our phase one, and we thank you very much for being there, we are not picking on you as an individual. You may not fall into these categories. It is what were the tasks, what are the techniques that are putting you at greater risk. So I want to make sure that we kind of defend that white paper a little bit. Just because we're not talking about something doesn't mean that somebody didn't do it, right? Correct.
And we are going to talk about limitations of the study in just a bit. It's important to know that we have to start somewhere. Right. So the initiative of past President Robert Anderson with this project, I think is really, it was something that needed to get done, and we can't do it all in one shot. We got to take it little chunks at a time. This is phase one, remember? So lots of places to go from this. This is not the end all be all, nor is any piece of job task analysis or research. Okay. It's just the next step in the conversation. So yes, Portia, thank you for that. And I'm seeing the videos and the pictures that are up. I really am grateful for everybody who participated in phase one.
All right, so getting right to those project limitations. This was a 30-minute session for each person, so it's not talking about cumulative exposure. This was a one-time task assessment. So as Adrienne said, where do we go from here? How do we adjust from here? And that is in our phase two, which we'll be talking about in a second. Is now we want to talk about how do we go through cumulative effect within this? How do we take this into our everyday practice? This brought up some good points to us, is that this whole concept of pressure, and this is such an interesting concept for all of us, is that pressure ratings, and we use that rating scale 1 to 10, but we all know that pressure is going to be specific to the person, to the tissue, to the therapist. And that it's an objective number, but it's also somewhat subjective as well. So some different ways we all like to talk about pressure. And I'll start with this. I learned this from a former colleague of mine and Adrienne's, would use the term, is this pressure tolerable? So put a word behind that. And I've always loved that word. So what are some of your secrets for pressure?
I've played with a lot of variations of this. Would you like more or less pressure tends to be the question that gets me the most accurate information. It's not a yes or no question. And they are more apt to say the pressure is fine, thank you. And I am to believe them because I gave them 2 other choices other than that. Is this pressure meeting your needs? Although it is a yes no question, I feel like shows that I am of service, and I want to make sure that the experience that they're having is effective. So those 2 have worked for me.
I use can you take more pressure? Period, the end. So they can say yes or no. But again, I want to remind listeners or viewers that so much of pressure is not about pressing down, it's about the direction of pressure. So to me, 45 is, along, the vertebra, or, depending on, we always go toward the bone. That's kind of what I like to do. If you're in the thigh area, depending on if you're on the side or on the top, 90 to 45. So I always get, when we're practicing, I get therapists to think about the direction, not only just the downward force, but the direction of pressure.
And also sometimes too, if I'm doing a particular technique, sometimes the integrity of the technique that I'm using and the goal of the massage as well. So I think those are all some things, and I know there's some good comments in the chat as well for some different things that people use. So thank you for that.
Yeah, like even going up the lower extremity, you're starting at, let's say at the ankle, you're going at a 45 up the tibia, the lateral edge of the tibia, light over the patella, and then pretty much straight down over the femur. So I mean, it just, even that one length, you're changing positions, and the pressure is going to be different where you are. So just think about those kind of things.
Oh, and I love that concept to then think about your mechanics in relation to that as well, right? Because of the more pressure, that it's going to adjust kind of our mechanics and our lean. So really, really thinking about those things. Yeah, some great dialogue with that. So now let's look ahead to phase 2. So our phase 2 is getting ready. We're in the process of working through this, and it's really looking at the benefit of pressure sensors to get us to understand our exertion level, about how much pressure we are using. And I know that Susan, you use some different techniques when you're teaching.
I do. I use a bathroom scale, and it works real effectively for people to understand that you can get with body mechanics and table height and a couple of other variables about half your body weight into the muscle, into the tissue. I love this.
Yeah, so I love using objective data in order to kind of develop that innate response, right? So getting that objective data to kind of move through this. And then also understanding that, yes, it's a physical aspect of what we're doing. So how can we best manage that fatigue? That's our next slide. And really this process is understanding these cumulative exposures. So understanding how seeing multiple clients during the day is going to affect things. Maybe we have great pressure early on, but we get to our last client, if we're fatigued, that may affect things. Maybe as we get towards the end of our work week, that may affect things a little bit. So again, this is our phase 2. We really want to look at some of these different aspects, and we're going to do that through my favorite way of data collecting, which is using wearable sensors. Wearable sensors are a great way to figure out what's going on. I always have my watch on, looking at things like heart rate, so to be able to look at that cardiovascular fatigue, being able to self-determine musculoskeletal fatigue. And as we're fatigued, how does that affect our ergonomics? How does that affect our positioning? So we've got the use of some position sensors to be able to do this in our phase 2. This is where we're heading. And if you're listening to this webinar and you love research as much as we love research, and you want to be part of phase 2 once it launches, please join our MassageNet practice-based research network. That is where we are going to pull potential research participants from. So there's no other way to get involved with this study without being part of the PBRN. So go ahead and sign up. We are seeking funding for this. We are seeking IRB, Institutional Review Board approval as well. So I'll put a shout out to Cal State Long Beach for my home institution for helping out with that, so that we can hopefully get actual research. Again, this was a job task analysis. This was phase 1. This was gathering our basis of information in order to create a research project. It will be that quasi-experimental research. We're not asking you to perform anything other than your normal massage. And we just want to know what you feel like while you're doing this. And this should not be something that would interfere with your clients' patients as well. If you would like more resources on the ergonomics, please come visit our Ergonomics Project page. Lots of information, lots of good conversation with members of our work group, with Robin Anderson, our past president, with lots of people. You can get a copy of our white paper that should be coming right up to you so that you can read this for yourself, and then maybe go back and listen to us, see how many times I can screw up saying ergonomist, and be able to, I know it's always on the last one, and then be able to come back and kind of follow through with everything.
And we have a ton of other free resources on the Massage Therapy Foundation website at massagetherapyfoundation.org. These are all available to you. Thank you to the individual donors and as well as corporate sponsors. The Registered Massage Therapists of British Columbia partner with us to help provide the free International Journal of Therapeutic Massage and Bodywork, open access, PubMed indexed research, the whole 9 yards. Lots of stuff on our website. Check that out. And all the ways to connect with us. Yes. So thanks for joining us today. To earn 1 CE for today's webinar, you could click on this link or go to massagetherapyfoundation.org/resources/webinars and complete the brief form and quiz to earn that CE. Thank you, everyone. Thank you for a really lively chat. For those of you who we didn't answer your questions, we're going to get back to you on that. And just to let you know, if anybody else might be interested in this, it will be available on our website, like Portia said. Have a great day, everyone, and stay safe.